Okay, this is my chest x-ray. My first step is to check the order. So I'm going to go over and get the order, and I'm going to find the patient's name and what kind of x-ray it is. It says it's a chest-2 view, PA and lateral, and I see the birth date and the patient's name is Jane Smith. So I'm going to set up my x-ray room. Come over here and choose my technique, chest PA, and I have a cassette here, 14 by 17 crosswise, shield, and this is detented. So also in theory I would pull up the x-ray on the computer. I would choose a PA and a lateral, but I'm not going to use the computer right now because it's busy. So my technique is photo time, but I would choose 105 and 5 roughly. So I'm gonna go get the patient now. Jane Smith. Here's my patient. Your last name, ma'am?
Smith.
Smith. And your date of birth?
10/27/89.
Okay. My name's Evan. I'm gonna do a chest x-ray today, so come on back. And I would ask my patient if she could change into a gown. And so I'd get a gown and ask to change into the gown. Remove everything from your waist up, including your bra if it has any underwire, any jewelry, your necklace or anything. And after she changes, we would go back to the room. So I would close the door for privacy. Jane, is there any chance that you are pregnant? No. No chance? Okay. Today we're going to do a chest x-ray. We're going to do 2 different x-rays. For this first one, I'm going to ask for you to stand with your chest against the board, facing the board. Okay, so I'm going to move the shield. It's important to shield. And we have the x-ray cassette already. Okay, I'm going to position my patient. So could you stand closer to the board with your body against it and your arms to the side, kind of hugging the board. And here's my marker. Left marker is going to go right here. Okay, let's get her positioned correctly. Get her centered. Move you slightly over to the left. That's good, just right there. Please try not to move. Okay, so get shield. Okay, so I'm back over here and everything's ready to go. Breathing instructions are Jane, go ahead and take a deep breath and hold your breath, and I would shoot and breathe. Jane. Okay, you can relax your arms. I would take this out. And in theory, I would ask Jane to position for the next x-ray. So Jane, will you turn and face me with your left side against the board? And I would go and I would place this into the reader and pull it up. And I would come back in position for a lateral. So we have a 14 by 17 lengthwise. Okay, Jane. So for this one, I'm going to ask you to grab a hold of that pole with both your arms and come closer over to the left, touching the screen, and I would go ahead and position there. Just take a small step forward for me, please. Back, I mean. Right there is good. I'm going to move my marker. And I want to make sure that she is lined up just perpendicular to the board. Just put my arm there and you see it's pretty straight, so there's not much rotation. Okay, I would have my technique ready again to lateral around 105 and 12. Okay, Jane, go ahead and take a deep breath and hold your breath and shoot. Okay, breathe and relax. Okay, I'm gonna grab the cassette out. Bring this back to the reader. Jane, just relax a few minutes. I'm just gonna double check those x-rays and we should be good to go. So I'm gonna put this into the reader and it reads it. And so this is my reader since I don't have the computer. This is the first x-ray I took. This is the PA. And I would look for the criteria. And thank you. So first of all, we look for the anatomy. We have the angles and the costophrenic angles and the apices both on the film. And then I see the scapula are out of the lung field. I count 8 to 10 ribs for a good inspiration. My technique looks good because I can see the spine through the shadow of the heart right here. And also we look for rotation. These SC joints look equidistant and non-rotated. So that's my PA. And my lateral, which is the second x-ray I took, also looks pretty nice. We see the posterior ribs, the ribs posterior to the spine, not much rotation. We have all the anatomy, and intervertebral disc spaces are open. We see the shadow of the heart, the hilar, the hilum, and everything looks good. So after I reviewed the images, I would come back to my patient who is just patiently waiting, and we got good x-rays today, Jane, so we're all done, and good luck with your procedure. Bye.